Polio by Abby King Taggart. Polio is an infectious disease contracted predominantly by children that can lead to the permanent paralysis of various body parts and can ultimately cause death by immobilizing the patient's breathing muscles. The agent that causes polio is poliovirus. Poliovirus is an RNA-based virus that lacks an envelope. The cell surface receptor for poliovirus is CD155, a glycoprotein that functions as an adhesion molecule in adherence junctions. In addition, CD155 is also recognized by NK cells to induce their cytotoxicity. Polio is a highly contagious virus that can infect only humans. It transmits through person-to-person contact and lives in an infected person's throat and intestines. Polio transmits mainly through means of a fecal-oral route. This indicates that polio is mostly transmitted by drinking water that has been contaminated by the feces of a person carrying the poliovirus. It enters the body through the mouth and spreads through contact with the feces of an infected person or droplets from a sneeze or cough of an infected person. A person may spread the virus to others immediately before and up to 2 weeks after symptoms appear. The virus can live in an infected person's feces for many weeks. It can contaminate food and water in unsanitary conditions, and people who lack symptoms can still pass the virus to others and make them sick. This virus also has no vectors. In the early 1980s, more than 350,000 people suffered from paralytic polio cases every year. In 2016, this number was only 46 paralytic polio cases. In the 1980s, the world saw 20 times as many paralytic polio cases every day than today in an entire year. Around the 1980s, polio cases worldwide were an estimated 350,000. Today, this number has fallen to around 407. This decline in the number of reported polio cases is more than a 99% decrease rate. As seen in these visuals, when polio cases were at its peak, countries like Mauritania, Sudan, Swaziland, and Laos suffered the most, with numbers ranging from 103 to 357 cases per million. Due to its relatively long incubation period of up to 10 days and 3/4 of infections not showing any symptoms, this makes polio extremely difficult to monitor, and the virus can spread for several months without being detected. While polio does affect all ages, it mainly affects children under the age of 5. There are 3 types of polio: non-paralytic polio, paralytic polio, and post-polio syndrome. Non-paralytic polio, also known as abortive polio, can last anywhere from 1 to 10 days. Symptoms of flu-like and can include fever, sore throat, headache, vomiting, fatigue, and meningitis. Paralytic polio, about 1% of polio cases can develop into this. It leads to the paralysis in the spinal cord, brainstem, or both. Symptoms include loss of reflexes, severe spasms and muscle pains, loose and floppy limbs, some paralysis, and deformed limbs. Lastly, post-paralytic syndrome. It's possible for polio to return even after you've recovered. This can occur 15 to 40 years after initial infection. Symptoms can include continuing muscle and joint weakness, becoming easily exhausted or fatigued, muscle atrophy, trouble breathing and swallowing, sleep apnea, low tolerance of cold temperatures, and depression. Paralysis is the complete or partial loss of muscle function in part of your body. Permanent paralysis fortunately only occurs in 0.5% of infections. Other symptoms concerning the whole body include fatigue, feeling faint, fever. Muscular symptoms include muscle weaknesses and quiver, and loss of muscle. There are 2 types of polio vaccines that are used: an inactivated poliovirus given by injection, IPV, and a weakened poliovirus given by mouth, OPV. Due to the poliovirus only being able to survive in humans, this makes it possible to completely eradicate the disease from the world. Globally, in 1980, only 22% of 1-year-olds were vaccinated against polio. In 2015, this increased to 86% of the world's 1-year-olds to be vaccinated. The name polio is derived from the Greek and translates to gray marrow. Gray marrow is the tissue in the center of the spinal cord which, when affected, causes paralysis. Since polio can lead to the death of an infected patient's lungs when paralysis immobilizes their breathing muscle, to prevent death by suffocation, Harvard professor Philip Drinker and Louis Agassiz Shaw invented the iron lung. This basically breathes for the patient. And then also, Franklin D. Roosevelt was diagnosed with polio in 1921 after he suddenly fell overboard off his yacht. This disease eventually left him paralyzed from the waist down.